California 2026 Standard Benefit Design Healthcare Expense Comparison. So the first step, once you've kind of focused on a health plan, is to get the premiums for the different metal tier levels being offered to you. In this case, the premiums are for a 60-year-old individual in Sacramento County, and it is the Blue Shield PPO plans, which even after a subsidy are quite high. You can get these rates through Covered California or going directly to the health plan or through the rate sheets. Now, I have included platinum plans within the worksheet because they do have different cost sharing and the way things are figured, and sometimes you can save some money. If you wanted a gold or platinum plan, you can go with the HMO. So you've put in your monthly premium amounts. You can put in the number of months that you'll be enrolled, 12, it's for a full year. Maybe it's going to be a partial year, so maybe you put in 6, and then the number of months times the monthly premium will give you your total premiums, and then that will also move down to the bottom of the worksheet. Then we get to different sections that are similar across all of the different health plans. This first section has some routine healthcare services, and they all have co-payments with them. So whenever you enter a quantity in one of the yellow cells, it gets populated across the different metal tier levels. The green cells are for dollar amounts where you can put in a dollar amount for a particular service or like the premium. This particular individual feels that they may have 2 urgent care visits and 2 specialist visits, along with some primary care and some therapist visits. And we can see that under the bronze plan, because all of them have set co-payments, they are looking at routine healthcare services subtotal of $1,360. The silver plan is $1,180. The gold plan, $940. The platinum plan, $360 for the same services. So that is very accurate because those all have set co-payments for those services. With the bronze plan, there are some healthcare services that are subject to a medical deductible. So those are kind of set aside a little bit different. Again, the green cells, if you know the rate for the service, you can put that in there so it'll be populated across when it is figuring everything out. Possibly this individual will have 2 diagnostic tests, and maybe 2 x-rays, and 1 image, like an MRI for the year. Now, the silver, gold, and platinum plans have generally co-payments associated with many of those services. The silver plan is a $325 copay for the image. You'll notice that some of these cells are in blue, which means that it is subject to a co-insurance percentage. So on the gold plan, generally imaging is going to be 25%, so it comes out to $250. If we put 2 images in there, it then goes up to $500 because it is 25% of 2,000. So you can see how the co-insurance reduces the overall cost. For the HMO plans, those imaging just have a set co-payment associated with them, not co-insurance. Then there are outpatient procedures, and perhaps this person believes they'll have 1 outpatient procedure, maybe arthroscopic surgery. Now for the silver plan, outpatient procedures are subject to 30% co-insurance, so this worksheet just takes 30% times 3,000 and comes up $900 for the total. The gold generally has 30% for outpatient procedures, but the gold plans, some of the coinsurance can vary depending on the specific type of service. So you'll want to get into the evidence of coverage and see if it is less than 30%, maybe 25 or 20%. The platinum plans have 10% coinsurance, so a $3,000 retail price for the outpatient procedure is $300. The HMO plans for outpatient procedures, gold is just $130, so that populates, and also for the platinum at $75. Hospitalization can be tricky at best. The silver plan, you must meet a medical deductible for the silver plan before you go into coinsurance on it. So here we have the deductible condition as being true. It has been met, so the deductible pops up, and then the worksheet takes the total cost of the inpatient hospitalization, if you happen to know it, subtracts the $5,200, and then applies 30% coinsurance and adds that together. The gold and platinum plans have no deductible, so it is a straight coinsurance. So the gold plan is $4,500 and the platinum plan is $1,500. Now, this is where the HMO plans differ slightly in that they do not use coinsurance for hospitalization, but they have a co-payment for the number of days that you're in the hospital. So you will need to put in a specific quantity, days, to come up with the price. Here, I'm assuming the person might be staying in the hospital for 3 days. So for the gold HMO plan, that's $375. And you can see the subtotal for that, and also for the platinum plans. And then just for the healthcare services, when we come down, you can see if the maximum out of pocket has been met. If it has been met, then the total healthcare services, which are all of the routine healthcare services, the x-rays, diagnostics, hospitalization, will not be considered in the total, but the maximum out-of-pocket amount will be considered. So that is your backstop. That's your maximum liability. With the bronze plan, I total up all of the services, the deductible has been met, and then go through subtracting $5,800 from the total eligible services subject to the deductible, and then multiplying that times 40%, and that came out to $6,160 for a total $13,320. But the individual had met the maximum out of pocket of $9,800, so that is the maximum liability for healthcare services. Then we go down to the pharmacy. And the bronze and the silver plan do have pharmacy deductibles. Generics generally have just a set co-payment across the board, including the bronze plan. So a unit of 1 is a 1-month supply of a particular drug. If you're taking the prescription for all 12 months, you would put in 12, and you will need to get the retail cost for on the bronze drugs in the tier 2, 3, and 4, and populate those in the green cells. These are just averages. Yours may be higher, they may be lower. The bronze plans also have a maximum cost for drugs tier 2 through tier 4. It is very difficult to figure all of that in, but essentially you will pay no more than $500 per month. So the drug costs for the bronze plan could be a little bit high if you have some very expensive drugs. But here, because the individual has purchased some tier 2 through tier 4 drugs, they have met the drug deductible of $450, and that is now going through. They have met the deductible, and that 450 is subtracted. We have the co-insurance and we have the total drug costs. On the silver, gold, and platinum plans, the T4 drugs, tier 4 drugs, are limited to $250 per month. So if a drug exceeds $250 after the deductible has been met with the silver plan, gold and platinum have no deductibles, then I have set up the worksheet to adjust for that. It subtracts out what the cost of the drug is under coinsurance and backfills with the maximum 250, and then totals up the drug costs. So you can see how the drug costs are limited by that $250 maximum on the tier 4, and that goes all the way across. Where it is not triggered in the platinum plans, then the adjustment is false, because this tier 4 drug is only $200 if you have a platinum plan, because it's 10% coinsurance of the retail amount. So we have our total pharmacy expenses, we add those to the healthcare expenses, and again, if it is greater than the maximum out of pocket, that is triggered. So are the health and pharmacy more than the maximum out of pocket? Yes, they are. So then we just have the maximum liability of $9,800 times the total premium. So plan plus premiums is $19,196. Under the silver plan, the maximum out of pocket had been met, plus the premiums of $14,000. So that individual is looking at $24,000 for the silver plan. Obviously, a better deal for the bronze if you hit the maximum out of pocket. For the gold plan, the maximum out of pocket has not been triggered because total drugs and healthcare spending are below the maximum out of pocket of $9,200. So healthcare expenses plus pharmacy plus premiums, $28,000. Similar with the platinum plan, total healthcare and drug expenses are under the maximum out-of-pocket amount of $5,000. And then you can go across and see, and then kind of get a feel for the overall cost of these plans. And there are a few notes down below about how the assumptions are made.